The key message from our presentation, which was about service improvement in an approved centre in County Laois, is that in partnership with regulation and the staff and the residents of the unit, it is possible to have rapid service improvement that is real, that is not just based on compliance and a paper ticking exercise, but it involves real change that improves quality of services and outcomes for both the service users, their families and the staff involved.
My role essentially in the process in Portlaoise in the Midlands area was in relation to compliance, or rather the lack of compliance that we found ourselves in with 4 particular areas. The Mental Health Commission in their visit in September 2016 identified 4 areas of cause of concern: the manner in which we did our individual care plans, our arrangements regarding child admissions to our adult acute mental health facility, our medication management processes, and then more alarmingly then our processes regarding seclusion, which was probably the most critical area. My particular role was as the compliance officer in ensuring that we were compliant with regards to legislation and the regulatory framework within which we operate.
I suppose being involved in the project group has helped us to influence how the project was designed. As being part of one of the pilot sites, it gave us an opportunity to look at our practice, critique it, look at our systems and look at our structures and our processes in relation to where we're at in relation to regulation, but also quality as well. I think what we learned was very much it needs to be a multidisciplinary approach. It needs to be very much staged and planned and coordinated throughout the year. Not to take a big bang approach to it, but just to look at key themes that are relevant and work through those and work systematically through those. It also, I suppose, gelled us as a multidisciplinary team as well too, that it wasn't just compliance was up to one individual, it was very much a team approach.
My name is Claire, I'm a member of the Quality and Service User Safety team. My area of responsibility is risk and incidents. Today I'm going to present on national trends in terms of service user safety. We're at the embryonic stages, so today a lot of the trends I'll be talking about will be relating to incidents and risks. I'm hoping in the future, if I'm giving a similar presentation this time next year, that we'll have the proactive piece, all the findings of safety assessment associated with the best practice guidelines, and that will give us a comprehensive picture of both our reactive and our proactive data that will lead to improvement for quality and safety for our service users in mental health.
We were involved as a pilot site in November 2016, and for us, with regards to standards, it became trying to comply with regulatory compliance and try and meet regulatory compliance was a big issue for us, like all acute approved centres. So it was great to have all the documents in one place, that we knew when we were meeting objectives, and I think it was said earlier in the conference, like you already are doing a lot of the stuff, and to actually realise that you're doing a lot of the stuff already was invaluable to us as a team. It was really nice to work with service users on the whole project and have their input. It also brought us together as a team because we were able to thrash out problems within the service together. And today, now to see it actually alive and real and to be sitting here at the presentation, it's fabulous, because I know the next steps are going to be so useful for mental health services across Ireland. The website, I can't wait to see that in action. I can't wait to see the whole, being able to input information and get our rating and kind of move forward with that. But also I think one of the big parts of the standards was having the ideas of how we could actually meet regulatory compliance and improve standards and services for people that use the services. So that's kind of what we got out of it as a team. Really exciting, and I'm delighted to be here today. So.